Good afternoon, Carl Springs, and welcome to our weekly Facebook Live question and answer. I have the pleasure of being joined here today by Commissioner Josh Simmons and our city's medical director, Dr. Peter Antevi. Together today, we're going to answer any questions that you have, so please feel free to comment those below the video. The last couple of weeks have been especially difficult for our nation, not just around the country, but also right here at home in Carl Springs. We're here today to talk to you about everything we can do to help you. We're going to provide you with updates from our medical director. Commissioner Simmons is going to provide you updates about our community. And we're going to work tirelessly to make sure that you have what you need, both financially and for support such as food. Today, I'd like to open it up to Commissioner Simmons to give us a brief overview about what we're doing here in the city of Carl Springs to help our residents. Commissioner?
So many people are out of work right now. And the federal government started issuing stimulus checks this past weekend. And if you are like me and still fortunate to be working, I would just ask that you consider making a donation to an organization that helps others. One organization in particular, which we'll be working with tomorrow, Feeding South Florida. They are constantly looking for volunteers and donations. Or if you know of any other food banks, reputable food banks, please consider donating to them. But also, if you want to support local businesses, or buy gift cards or meals from local restaurants, consider purchasing those meals too, or those gift cards, and then donating them to families who are going without. We all got to come together right now and lift each other up, right? This is a time for our community to come together and be good neighbors to each other.
Thank you, Commissioner. And I think that we can all agree, and during the last couple of weeks has been especially difficult for us here in the city. And so I'd like to take a moment to just thank all of our frontline workers, our doctors, our healthcare providers, our first responders, and folks like people at Feeding South Florida that are out there doing good work to help our community each and every day. You have all stepped up to meet this challenge, and we greatly appreciate it. I'd like to provide a quick update on some emergency orders that were signed here in the city of Carl Springs. City Manager Frank Babnick signed Emergency Order 20-13, which requires all of our residents, visitors, and employees to wear masks when out in public. This order does not require you, I repeat, does not require you to wear surgical or medical style masks. You can wear a cloth mask made from bandanas, t-shirts, or other homemade and available at home materials. We really feel that this is going to help prevent the spread of this disease and will help our city to contain it. With that, I'd like to pass this over to Dr. Antevi. Dr. Antevi, can you please provide us with a little bit of information about why the CDC is recommending us to wear these face masks?
Sure, Alex. Thanks for having me again. Hi, Coral Springs. This is very important for the prevention of the spread of the virus. And we understand that even if we're kind of close to each other and I laugh or I speak, that virus is kind of going out towards other people. And so we understand that in order to mitigate the spread of the virus, as they say, flatten the curve, we have to protect ourselves, and especially when you're out in public. I really 100% agree with covering your face. It's going to be the new look. Every time I go out for anything here, when I'm doing with the fire department, I have a mask on. If I'm touching anything, I have gloves on. And so the CDC has recommended for the general lay public to use a cloth-based mask. And if you go on their website, actually, it tells you not only how to wear it, it tells you, kind of the do's and don'ts. Should you wash it? The answer is yes. Washing it in the laundry, in the washing machine is perfectly appropriate. And then they even give you, I'm looking at the website right now, sewing instructions on what material to use and a little tutorial on how to put it together. So I would say have some fun with it, get creative, do some things with your kids so you're not watching Frozen 18 times. And actually make it something that's worth your while, but I think very, very important thing to do.
Thank you, Doctor. Excellent suggestions there. And I would like to remind our residents, as we're talking about the importance of wearing masks while out in public, we're still under a safer at home order. So please limit your trips outside your home as much as feasibly possible. If you're going to the grocery store, the pharmacy, or another essential business, be sure to wear that mask. And also take advantage of different opportunities that exist to get those supplies delivered to you Multiple pharmacies have online ordering with delivery. There are a lot of online shopping tools that allow you to get things delivered directly to your home. So please do your part to prevent the spread of this virus. Before we move on, Commissioner Simmons, do you have any more updates that you'd like to share before we start to get into some more COVID-19 related questions?
Yes. I know we are all still wading into the unknown. That's a Frozen 2 reference for you, Dr. Antebi. But I would like to remind everyone of our next remote commission meeting, which will be held this Wednesday at 6:30 p.m. Residents who wish to, speak during the commission meeting, during the public comment section, please submit a written request to the city clerk. You could do that before the commission meeting by filling out the form online or by calling in during the meeting. And you can call 954-344-5900. As always, even though we're having virtual meetings, we still want to hear from you. We still want to, we still want you to interact with us. So please, if you feel the need to, please, make a comment during our commission meeting. Residents are also invited to watch the meetings, even though they're virtual for us. They still will be live streamed on City TV. They'll also be streaming on Blue Stream channels 25, 25.2, 725, and on AT&T Uverse channel 99. So thank you, Alex.
Thank you, Commissioner. I appreciate that. So we've been getting a lot of questions about how many cases we have here in the city of Coral Springs. So I want to give you a little bit of information. Right now in Broward County, we have just under 2,900 cases, and 105 of those are confirmed here in this city. Now, we do expect those numbers to continue to rise for a couple of reasons. Chief among those is we're getting access to more and more testing. So as we get access to more testing, we're going to be able to test more folks, and in turn, people who have the virus will be confirmed, and we will watch our cases grow. We're continuing to watch a lot of different models. A lot of these models are predictive. They look at the amount of cases we have, and they try to determine the rate of spread and determine where we're going from here. So we'd encourage our residents to continue practicing your social distancing, continue to follow the recommendations of the CDC and our emergency orders, because we have watched a reduction in the infection rate, and we're hoping that that's a really good sign as we continue to follow these social distancing measures. Before we move on to the question and answer with Dr. Antebi, Commissioner Simmons, you'd asked to share a couple words thanking our first responders. I'd like to open that up for you.
Yes. As always, I am very proud of our first responders. Our fire department has been doing an amazing job protecting our most vulnerable at the assisted living facilities. They've been proactively providing personal protective equipment to their facilities, to those ALFs, as well as helping them request items from the Department of Health and the state. I think you'll find that Coral Springs is top notch when it comes to how we've been responding to the most vulnerable in our city. And so our fire department and our first responders, their work is inspirational, to say the least. And as our city manager would say it, we are one team with one mission.
Yeah, I think we're most definitely one team with one mission, working hard to keep our residents safe and healthy. With that, I'd like to turn it over to Dr. Antebi to answer some of our COVID-19 related questions. Dr. Antebi, to start, we've been getting a lot of questions about the antibody test kits and when they would be available. Would you mind answering that question for our viewers?
Absolutely. The antibody test kits are exciting, although I would caution people that there's a lot of unknowns with them. Obviously, you've heard of, let's start with the negative sides of things, that you've heard of the shipments that have gone over to Spain and the UK that were faulty tests. And so there's always a risk here that those tests are going to come across and they're not as promised, if you will. The FDA is not really providing approval to any of these companies. And so there's about 93 companies out there now who are selling these tests, who are allowed to sell them in the United States. And interestingly, what we just heard this past week is that those tests are going to be only allowed to be sold or distributed through a person who has a CLIA lab license. That means when you have your own blood sugar tester, your glucometer at home, you can buy that at CVS. Even though this test is just as easy to do, we just got word that the FDA is not going to allow the lay person to just do it on their own. And if you're a health professional, you have to have a CLIA license to do that. That's pretty complicated to get. So what does that mean? It means that we have to be sure that the product we're getting is correct. We have to make sure we're doing research behind it, and we have a very large research project that's underway right now with the help of our great city manager Frank Babinick and the entire commission. We're going to be reporting back our data, but I want to tell people who want to go buy those tests and so forth, unfortunately, they're not going to be made available to you. And it looks like the route the FDA is going to take is that they're going to want you to go seek out that test at a Minute Clinic, at your regular doctor's office. It seems like they're going to be making access to those tests a little harder than we think. So we're looking into that right now, but I will assure you that whatever we do here in Coral Springs will be data driven. It'll be by the book, and we'll come back and hopefully in another week or two be able to provide more data than we already have.
Thank you for that, doctor. And a couple of other follow-up questions here. How long does it take for a patient to recover from COVID-19? And also, do you know when we can expect a vaccine for this virus?
Yeah, I think that the question of a timeline is very important. With regarding symptoms, everybody's different. So you may have people who have 0 symptoms, not a 1. Some people are only losing their smell and their taste. And by the way, if you have a loss of smell or taste, that's a very common finding that you have COVID-19, and you should probably get tested for that. Not probably, you should get tested for that. Some people will have symptoms for a couple of days. Most people, though, who end up having more moderate disease will have at least 2 weeks until they kind of get back into themselves again. Although we're hearing of some people who are having symptoms for 3 weeks, and they kind of come and go. So the answer is it can be anywhere on the spectrum, but if you're somewhere in the moderate where you haven't gone to the hospital, but you kind of feel like you may have to go to the hospital, if you're in that situation, you're looking at 2 weeks. And of course, there's that percentage of the population who's going to get sicker and end up in the hospital and God forbid in the ICU. We are 2 weeks away from our peak, our projected peak here in Florida. So now's the time where we're in the home stretch of the peak. That doesn't mean it's going to end in 2 weeks, but I just want you to know that this is the prime time right now. This is kind of what we've all been preparing for, specifically our nursing home population, which, as the commissioner said very eloquently, we've been working really hard with them for months to avoid them from actually having a significant outbreak, and knock on wood, it's been successful thus far. So vaccine timeline. So potential vaccine availability, you're looking not until March 2021 is the timeline I have in front of me here. And so we also have a timeline for when these cases are going to drop. So we're looking into the July or August when the cases will go down to kind of a very bottom baseline. But then they're looking in November to December of a second peak, a second wave coming in again. So we may have schools reopening. I predicted they will reopen at the start of the school year. But then unfortunately, right around Thanksgiving, it appears there'll be another bump. I'm sure we'll see it in China, who just a week or so ago opened up their entire cities. I think now we're going to see a bump from them. So we're going to learn from what's happening in China, and we'll come back and report back here. But this ride is not over, folks. And I want everyone to understand that whatever we do, let's do it safely. Let's do it in a way that's appropriate for the city as well.
Thank you, doctor. And so I think it's important for folks at home to realize that a potential vaccine is not the ace in the hole. This is something that's not going to be available to us in the near future. So we need to continue with our social distancing, continue following the CDC's guidance to prevent the spread of this virus. Before we close here today, I want to share a few different phone numbers and a few different ways that you can stay connected with the city of Coral Springs. First and foremost, we have our city's call center, which is available at 954-344-1001. If you would like to speak with somebody on city staff about any questions related to COVID-19, that's the number for you to call. We also have our city business hotline open, which is 954-344-5772. And that's an opportunity for business owners in our city to connect directly with our economic development staff. We're trying to work on solutions to help your business around the clock. So please feel free to call in for questions about programs and assistance that's available for you. We also have our city senior VIP call-in number, 954-340-5001. That is a pre-recorded line that provides our seniors with all the information they need to know from the city of Coral Springs. So if you or somebody close to you is not on social media, please make sure you're sharing that phone number with them so that they can call in and get daily updates. And finally, you can get automatic text updates from the city by texting the keyword Coral Springs, all one word, to 888-777. And that'll send you text updates directly to your cell phone. So with that, I'd like to thank Dr. Antevi and Commissioner Simmons for joining us here today to answer a few questions that you have. If you've missed the broadcast or you have additional questions, feel free to put it in the comments section and our staff will follow up with you after this. We are going to continue to have live events for you to answer your COVID-19 questions moving forward. So please stay tuned to our Facebook page and stay tuned into our website. Before that, I'd like to open it up. Commissioner Simmons, before we close, do you have any other remarks you'd like to share with our residents?
I just wanted to say thank you to our healthcare professionals. Thank you to our teachers. Thank you to the moms, to the dads, to everybody in Coral Springs. We're all making sacrifices together to get through this. And I just want to reiterate that we have to be good neighbors to each other, that this is a time for us, even though we are socially distant, this is a time for us to come together and do our part in getting through this. This is something that is very rare in human history for one event to affect the entire world all at the same time. And so, as we are all going through this, be mindful, number one, of the blessings and the comforts that you have. But number two, let's think about those that could use a little sunshine and light in their day during this period. So I want to thank everybody again for taking all the small sacrifices that they have been making during this process.
Thank you, Commissioner. Very well said. I couldn't agree more. So with that, we will close our Facebook Live question and answer for today. Please stay safe, please stay healthy, and please stay home. Thank you and have a good night.